Hello, I'm Dr. Joel Wallach, and today we're going to talk about early warning signals. Doctors like to have people come in at least once a year for a annual physical. What they're doing is they're telling you, look, if you come in once a year, I can spot things early and we can actually work on them and save you from more pain later on. If we catch things early, we're more likely to be able to deal with it and manage it better. And so they know the principle of early warning signals. Now, the interesting thing about a doctor, they have less than $100 worth of stuff in their examining room. Now, they may have some chrome-plated shiny couches and examining tables, but other than that, as far as diagnostic stuff, they have less than $100 worth of stuff. They've got a stethoscope, they've got a blood pressure cuff, they have a thermometer, they may have a little rubber mallet to check your reflexes. They can have a AAA battery pen light to look in your eyes and down your throat. And you can go to a pharmacy without a prescription, and for about $65 to $85, you can get all that stuff and insert it in the box of each one of these little tools or instruments, if you will, is a paper insert, usually a single fold, that's in 5 languages and tells you how to use these things. If you can read 5th grade reading level, you can learn how to use all this stuff. And so you don't need to go to a doctor. You know, the co-payment is $20 to walk in the door. Well, after a couple of times, you've sort of paid for all this stuff, and then after that, it's free to check your own blood pressure, to look down the throat of your own kids, or look in your eyes to see if your pupils are equal and reactive, looking in the mirror. You can do all that stuff. And then, for the test that a doctor might send you to a lab for, or a hospital, with the exception of x-rays and CAT scans, MRIs, with the exception of ultrasound, these types of things, you can get most tests from a pharmacy without a prescription and do them yourself. There's actually test strips to dip into a sample of your urine to see if you have sugar or protein, to see if you have an infection, to see what you might have in your urine. Okay? You can get test strips to see what your blood cholesterol and your blood sugar is. You can get test strips to see if you have blood in your bowel movement or your stool sample. This is called occult blood. It's not like you're going to see blood with the naked eye, but twice a year you can check that yourself. A couple of bucks for these test strips, and you can do your own screen for things like colon cancer and stomach ulcers and blood-sucking parasites and ulcerative colitis, anything that might produce blood in the GI tract. And it's non-invasive. You do it yourself. You save the $20 co-payment to go in to the doctor. Now, if you find blood, then you want to go in and get an examination, right, and find out where it's coming from. There's also things to find out. There's little test strips the ladies can urinate on, or get a urine sample and dip the test strip in it and find out if you're in premenopause, menopause, or postmenopause. You don't need to go to a doctor to find that out. For a few bucks, you can get your own test strip to find out. There's test strips for $7.95 at the pharmacy to see if you're pregnant. Now, if you go to a doctor, you have to be charged an office visit plus a special exam to see if you're pregnant. They take a blood test and a urine test. You come back 3 to 5 days later, they charge you for another office call, and then the special visit to translate all the information to you. They say, I'm sorry, dear, you're not pregnant, but it's $500 for all this stuff. Or for $7.95, you can go to a pharmacy and get your own pregnancy test kit, and you're done. Do it in the privacy and comfort of your own home. You don't even have to get dressed up and pay parking and all that kind of stuff. So you save a lot of money and time and aggravation, and you're more likely to read the test correctly than somebody who's in a rush and not really thinking about you personally. And with that said, guess what? We can teach you the early warning signals. There are over 500 of them that I know of, maybe about 525, 535. And we're going to talk about a few of the big ones today. Some of the things that I find interesting is when people ask doctors about these early warning signals, the doctors, well, you're getting old, you just got to learn to live with it. And they've learned the same thing that I have, so it's really shame on them. Liar, liar, pants on fire, because when they see these early warning signals, they should be telling you, hey, this means this, and we can jump on this right now, and we can fend off this disease before it disables you or kills you. Give you some examples. Eyelid twitches, toe cramps, foot cramps, leg cramps, back muscle spasms. These tell you you have a serious mineral deficiency, primarily calcium, but could be many of the cofactors that are required for calcium to work properly, 89 of them, in fact. But it has something to do either directly or indirectly with calcium. You have eyelid twitches, toe cramps, foot cramps, leg cramps, back muscle spasms. And if a doctor says, look, just go get some quinine out of the drugstore and take that, and oh, you might rub, get somebody to do a foot massage for you. That's good first aid, to be sure, but it doesn't deal with the basic systemic problem that's underlying this. If you don't deal with it forthrightly and supplement with minerals, what will happen is this calcium and cofactor deficiency will begin to progress so that other things begin to happen. You'll start getting insomnia and high blood pressure and loose teeth and periodontal disease, which is nothing more than osteoporosis of the facial bones and the jaw bones. That's all that periodontal disease is. It's not the lack of flossing. Do you ever hear of a tiger floss or a wolf or a coyote or a fox floss? No, they don't get gingivitis and so forth. Their breath stinks, but they don't get those problems. Well, you can actually, here's another one. If your fillings fall out, you can go to a grocery store or pharmacy, and with just a few dollars, I don't know, it's $5 or $10, you can actually get an emergency filling to put in. It has some stuff to clean out the cavities so that you don't have any bacteria left in there, sterilize it, and then you can put that emergency filling in. Sometimes they last 5 or 10 years. It just costs you $5, especially if it happens on the weekend, right? And so these are the early things you can begin to do, and they all have to do with calcium deficiency. You're going to get compression fractures if you don't deal with it. You're going to get arthritis and osteoporosis if you don't deal with these symptoms early. And some of these symptoms, you have maybe a little 3-year-old kid that gets eyelid twitches and toe cramps and foot cramps. You get big athletes, high-priced professional athletes that get Charlie horses. You see them fall on the field and trainers run out and they have to massage their leg and stretch their toes and all this kind of stuff. It's really a calcium deficiency. And then they wind up with fracturing their hip or their knee, kind of like Bo Jackson. He was a great two-sport player. He was a two-sport player. He played football and baseball, was excelled in both of them. But he wound up getting hip fractures, having to have his hip replaced. And I guarantee you he had early warning signals for years and years and years and years before that happened. And the trainers just put him in a whirlpool bath, or maybe they gave him some liniment massage into these aches and pains when he really should have been getting high levels of the proper kinds of calcium and the 89 cofactors necessary for that calcium to work properly. And then we have white, gray, and silver hair. White, gray, and silver hair is one of my favorites. Einstein died of a disease called a ruptured aortic aneurysm. It's caused by a copper deficiency, and copper deficiency is signaled early on by a loss of hair color. Copper is required as a cofactor to convert an amino acid in our diet and our tissues called tyrosine into melanin, which is the basic pigment in our hair color. It doesn't matter if your hair is blonde, red, brown, or black. If you have white, gray, and silver hair, you have a copper deficiency. Now, copper deficiency can also cause a breakdown of the elastic fibers in our body. When you get a breakdown of the elastic fibers in your skin, you get wrinkles and crow's feet, deep furrows in your brow. And Einstein had all of this. And also, if you get a breakdown of the elastic fibers in your veins, you get spider veins, varicose veins, and hemorrhoids. And if you get a breakdown of the elastic fibers in your arteries, you actually will get a swelling or a bubble or a balloon in the weakest area called an aneurysm. If you have a small one rupture in your brain, you get a bleeding type of stroke. If you have a small one rupture in your eyes, you get a detached retina or maybe just a bleed in the eye. If you have a larger one rupture in your brain, coronary artery, aorta, pulmonary artery, or the iliac arteries before they go down into your legs, you'll wind up dying in seconds like you've been stabbed or shot through those arteries. Okay, all because of a copper deficiency. Again, Einstein died of a ruptured aortic aneurysm when he was age 76. He won the Nobel Prize in Physics when he in 1921. Okay, and it's just tragic that somebody with that brilliance, or anybody for that instance, dies of something as simple as a copper deficiency. He had two blatant signals. If you look at all his pictures, he's just full of wrinkles and gray hair. And then another early warning signal are age spots and liver spots. When you have age spots and liver spots, they indicate that you have damaged fat in your body. You have damaged fat, damaged cholesterol, and you're being naughty. You're taking in lots of free radicals. You're eating too many fried foods, margarines, cooking oils, meat cooked well done, burnt animal fats. And as you consume those bad things, and if you're not taking in enough antioxidants to protect you, this fat gets damaged it turns into what's called ceroid lipofusin. That's this golden brown color you see when you have age spots and liver spots. And if you have 6 of them on the outside, you have millions of them on the inside. Excuse me. This is not just a problem, a cosmetic problem when you have liver spots and age spots. And so taking one of these skin bleaches to get rid of these age spots and liver spots is not dealing with a systemic problem. Because when you have 6 on the outside, you have millions of them: the brain, the eyes, the liver, the thyroid, the kidneys, the bone marrow. And so you're headed down a road in which you're more likely to get cataracts, macular degeneration, Alzheimer's disease, cardiovascular disease. Your risk of cancer shoots way up in the air. And so you've got some real work to do here. So you have to get all the fried foods out of your life. You have to supplement properly with all the essential nutrients so your body can support maintenance, repair. Also, you need to supplement with every antioxidant you can think of. When you're in that point, you want to err on the side of excess with antioxidants. And as the age spots and liver spots begin to go away on the outside, believe me, they're going away on the inside. And it's very, very important to watch the liver spots and age spots, because they are certainly early warning signals of many, many different disabling and life-threatening diseases. Another early warning signal we want to look at is the noisy joints. Your neck sounds like a bag full of gravel. Your jaws pop and crack when you chew or talk. You have achy joints, knees that pop and crack when you squat down. I had one guy the other day at this basketball draft, and he said, listen to this, and he's walking and his hips are clicking, and obviously he had calcium deposits and bone spurs in his hips. And this is not genetic, this is not an age thing. These kids are 20 years old. What it is a early warning that you have osteoporosis. And of course he was living on soft drinks, he was living on carbonated drinks. His efficiency of absorption of minerals had gone way down. And he's living on French fries and hamburgers, so that he wasn't getting all of the minerals he needed to maintain and repair his bones. And so just noisy joints are a huge signal. When you hear these kids popping their knuckles and they're always twisting and turning and cracking their necks and so forth, they already have arthritis and osteoporosis. And you're headed towards loose teeth, receding gums, gingivitis, periodontal disease, tooth loss, loose teeth. All of those things are directly related to mineral deficiencies and osteoporosis. And even then, you're headed towards insomnia, hypertension. You're headed towards shrinking, compression fractures, life-threatening fractures of the major bones, hips and long bones of the body. As you get older, that's very, very dangerous. And then we have another early warning signal called cravings. When people have psychotic cravings, people say, well, I'm a chocoholic. I have to have chocolate after every meal. I just wake up in the middle of the night and have to have chocolate. People say, I'm psychotic about eating salt. I go through a whole salt shaker a day. I go through 10 soft drinks a day. I have to have them. I cannot live without them. When people have the psychotic need to consume a particular thing, or any snack food for that matter, or when you open a big bag of chips, for instance, and you can't just eat a handful and quit, you have to eat the whole bag, this tells you that you're minerally deficient. Any mineral deficiency will cause cravings. Any mineral deficiency will cause cravings. 2 or 3 of them together is going to cause a psychotic need to eat. And you're headed towards obesity. You're headed towards diabetes. And so you have to deal not only with cutting back on the carbohydrates, which you can do just by sheer will alone over time. That psychotic need to eat, is going to overwhelm you, and you're going to wake up in the middle of the night and eat an entire German chocolate cake, or you're going to eat an entire German dessert, or schnitzels. You're going to eat an entire ham. And so these are signals you do not want to ignore. They're not just some small thing. Your body is screaming at you. Your body's trying to give you a message, okay, when you have these cravings. Now, rapid loss of weight or gain of weight, this is another warning signal. It could mean you have diabetes. It could mean that you have other serious diseases. And so when you have a very rapid when you have a very rapid loss of weight or a very rapid gain of weight, you need to investigate what's going on there. Why has this happened? And of course, this happens for a variety of reasons, including diabetes. You can be eating tons of food and losing weight because if your insulin is not working, if you don't have the mineral cofactors necessary for your insulin to work, what you're going to find is that you can be eating tons of food and you'll still lose weight. This is one of the early warning signals of diabetes. There's also hypoglycemia. That's another early warning signal of diabetes, is hypoglycemia, low blood sugar. And this is when people eat something sweet, consume a soft drink. The insulin they have drops their sugar levels very rapidly, and they can get agitated, they can get angry, have anxiety attacks, panic attacks, they can have hyperactivity, they can go into rages and anger. There's also a blood sugar problem called narcolepsy. You used to read this in the old stories going back to Homer's days, 300 BC, where people would be talking to somebody and just fall over in a deep sleep. This is called narcolepsy. The modern name for it is hyperinsulinemia. This indicates deficiencies of certain minerals, including chromium and vanadium, which is going to tell you, look, if you don't do something about this, within months or years, you're going to wind up certainly with diabetes. You're going to wind up with a big problem with diabetes. Another early warning signal is cracked cuticles, hangnails, cracks in the side of your index finger, ends of your thumbs, your heels. And when you have hangnails, when you have cracked cuticles, when you have cracks in the side of your index finger, ends of your thumbs, your heels, that tells you you have a deficiency of omega-3 essential fatty acids, or you have a ratio problem between omega-3s and omega-6s. And this tells you that you're at extremely high risk for the formation of blood clots or thrombosis in your body. You can get deep vein thrombosis in your legs. If you travel a lot by air, or if you're a truck driver, you're over-the-road truck driver, and you're in trucks for hours and hours and hours, you're traveling across the country, you're in trouble. If you're on birth control pills, if you look at the warnings on there that say you're at high risk for getting a blood clot, deep vein thrombosis, if you use birth control pills, or HRT, hormone replacement therapy for menopause. And if you have cracked cuticles and hangnails and cracks in the side of your index fingers, ends of your thumbs, your heels, you're at extreme high risk of deep vein thrombosis in your legs, pulmonary embolism, which can be life-threatening, a blood clot or a thrombosis type of stroke in the brain, a coronary thrombosis type of heart attack, all because you're deficient in omega-3s or have an omega-3, omega-6 ratio problem. Now, let me tell you that these things are totally avoidable. There's no reason for people to have these types of problems. When you see these early warning signals, and again, there's over 500 of them that I know of, if you just, for instance, would use a Vaseline-intensive skincare on these cracked cuticles and hangnails, cracks in your fingers, if you use Pond's hand cream, gosh, that feels good, and you get some kind of first aid type of relief. But it doesn't solve the systemic problem of the abnormally sticky platelets when you're deficient in the omega-3 essential fatty acids. And so you do have to supplement properly. And as you supplement properly with the omega-3 essential fatty acids, get rid of fried foods, margarines, cooking oils, and meat cooked well done, what happens is within weeks, these cracked cuticles and the hangnails and cracks in the side of your index fingers, ends of your thumbs, your heels, will heal and go away. And when they're healing and going away on the outside, the abnormal stickiness in the platelets and your red blood cells will go away. And the odds of you getting a deep vein thrombosis in your legs, a pulmonary embolism, or a blood clot or thrombosis type of stroke, or a coronary thrombosis type of heart attack is reduced to almost zero. The last early warning signal we want to talk about is elevated blood cholesterol and triglycerides. And this can be caused by a deficiency of omega-3 essential fatty acids, an omega-3 essential fatty acid, and an omega-6 essential fatty acid ratio problem. It can be caused by a deficiency of niacin, vitamin B3, a ratio problem of the good cholesterol and bad cholesterol, the HDLs and the LDLs, can be caused by a deficiency of chromium, vanadium, two trace minerals involved with not only sugar but lipid and fat transports in your body. And it could mean an early stage of diabetes, pre-diabetes. If you look in the medical textbooks, one of the first signals in the blood that you're heading towards diabetes is your blood cholesterol and triglycerides go up. You could have low thyroid or hypothyroid. You could be heading towards a goiter. One of the first symptoms in your blood, signals in your blood, early warning signals, is that your blood cholesterol and triglycerides go up. So when you have a blood clot, it was because your blood cholesterol was elevated that you had a blood clot? No. It was because you were deficient in the omega-3 essential fatty acids, and the symptom of that deficiency of omega-3 essential fatty acid was an elevated blood cholesterol and triglycerides. The symptom of a ratio problem between HDL and LDL, good cholesterol and bad cholesterol, is you're not taking in enough of the antioxidants and you're eating too many of the free radical generating foods. And as you go through our books, you're going to find that these things are very, very simple. You don't need to have 14 years of medical school to figure it out. If you can make a cookie recipe for oatmeal raisin cookies, if you can read the 5th grade reading level, you should be able to take care of all these things. And over time, you can go to the pharmacy and buy a thermometer. Over time, you can buy a blood pressure cuff. Over time, you can buy some tongue depressors. Over time, you can get a AAA battery pen light to look in your eyes. Over time, you can get these test strips to see if you have blood or sugar or protein or infection in your urine. You can get test strips to see if you have blood in your bowel movement or your stool. You can get test strips to see if you're pregnant. And you'll be amazed at how much you can do yourself. People say, well, what about stitches? Well, what you can do is just clean out that wound with good antibacterial soap. Use some colloidal silver to disinfect that wound. And then you can go to a pharmacy and buy butterfly bandages or steri strips and do it yourself. You don't need stitches most of the time. Let me tell you, you can do it yourself. We can save America. Let's do it.